this situation?
Jackie Dean.
In June last year, the Minister of Health, Jonathan Coleman, wrote to the Southern District Health Board saying he no longer had confidence in the board. The board had a forecast deficit of $27 million, a figure which had doubled over the last 6 months, with larger deficits over time projected to go to $42 million. As a result, the SDHB proposing a 5% cut in funding for the 3 small hospitals in my electorate, Oamaru, Dunstan and Ranfurly. All of those hospitals are community-owned and loved, and all were performing well and within budget. Those communities rose up. For my electorate of Waitaki, the news of the appointment of commissioners was greeted with relief and with hope. Relief that the board's plan for a 5% funding cut was halted, and hope that the commissioners would be able to tackle not only the increasing deficit and reintroduce financial stability, but also to refocus on health services to patients, not only at Invercargill and Dunedin hospitals, but also into our rural communities. My position has always been very clear. In the many meetings I have had with the previous board, management and now commissioners, my focus is on the SDHB providing funding and support to rural hospitals so that they can best serve their communities. The answer never was a 5% cut in funding across the board, and I want to thank the Minister for listening to the many representations made by community leaders, MPs and rural hospitals, which led to his decision. The Commissioners are now making good progress, but the job is not yet complete. The Commissioners badly need to redevelop Dunedin Hospital. They need to look up and they need to look out and seize the opportunity to better utilise the high-performing rural hospitals. It is time, Mr Speaker, to focus on what really matters here. Southern has made good progress on the new faster cancer treatment target, up 10%. Southern has surpassed the elective surgery target by 7%. There are some good health outcomes being achieved. So it's time to get in behind the commissioners as they tackle some very significant issues. It's time to support the clinicians, the medical staff, the nursing staff and management of Invercargill and Dunedin hospitals who look after our parents, our friends and our families. There is always a place to highlight deficiencies in this service. This is, after all, a publicly funded service. But there is also a need to support the DHB as they work towards our expectation of an improved deficit position, but more importantly, a cohesive, region-wide delivery of good quality health services. I commend the bill to the House.
Jane Logie.